A very good morning, students. Now, this is the heart removed from the body, just to show you the surfaces, borders. Okay. Now, the heart, as we have seen that it is conical. This is the outermost apical part. This is the apex of the heart, and opposite to the apex lies the base of the heart. And here, the base of the heart is this area formed by mostly by the by the left atrium. So this is where the pulmonary veins are opening. This is that of the left atrium is the base. Then this is the right border of the heart, which is formed by the right atrium. Then this is the inferior border of the heart, which is close to the diaphragm, and this is formed by the right ventricle as well as the left ventricle. And then this is the left border, which is formed by the left ventricle. Okay. Then there is a superior border which goes from one atrium to the other atrium here, which is overlapped by the pulmonary trunk and the aorta. It lies behind that. Okay. It is an oblique border. So these are the four borders. Between the right border and the left border here, this lies the sternocostal surface, and beyond this inferior border of the heart, this surface which rests on the diaphragm is called as the inferior or the diaphragmatic surface. The third surface here is the left surface, which is mainly formed by the left ventricle and the left atrium. See this area is that of the left atrium, and this is left ventricle, and this is the left auricle is here. So this is the left surfaces. So these are the borders and surfaces of the heart, which is the external features of the heart. Okay. Now I will show you the transverse and the oblique sinus again, because when in the last video when I saw it was the heart was attached with that of the body it was, and I could not show you that oblique surface properly. So let us see this. When you pass your finger between the pulmonary trunk and the atrium, the arch of aorta, okay, just in front of the superior vena cava. See this is the superior vena cava, which is opening into the right atrium. Then your finger should go in front of the superior vena cava. As I said, this is the oblique sinus of the heart, okay, where the forceps is there. This shows the oblique, and as I told you about its applied importance, that in the lung heart machine or the heart lung machine is attached in this. First we have to tie this the atrium, aorta and the pulmonary trunk, okay, by passing a finger, okay, deep to that of the in the transverse sinus, and then the heart lung machine is attached to the pulmonary trunk and to the aorta. Okay, then let us see the position of this is the inferior surface or the diaphragmatic surface is here, and if you see this base of the heart, okay, which is also sometimes called as the posterior surface of the heart, you can see that there is the oblique sinus. Now you can see here, these are the pulmonary veins which are going and opening into the left atrium. This is left atrium, and this is the inferior vena cava opening is here. These two are the right pulmonary veins opening into the left atrium. So these are the pulmonary veins, and if you just put your finger between the opening of the right and left pulmonary vein, this is obstructed because of the reflection of the serous pericardium first onto the posterior wall, that is to the wall of the left atrium, and then it goes on to the parietal pericardium. So this is that it is obstructed here. So this area is the oblique sinus, whose one of the wall is formed by the wall of the left atrium between the opening of the right and the left palm, where I am putting the finger here. With fingers are here. So this completes the external feature. This is the pulmonary trunk coming out, and then this is the arch of the aorta is here. Okay, this is the fibrous pericardium. Okay, and this after covering through the fibrous pericardium, the parietals serous pericardium will become continuous onto the surface of the heart as the visceral pericardium. So this is parietal part of the serous, and this is the visceral part of the serous pericardium. See here, this fibrous pericardium is adhering with that of the great vessels, okay? That is the pulmonary trunk, and to the arch of the aorta is here. Right, in the next this section, what I am going to do to show you is that I will expose the coronary artery, right and the left coronary artery on the sternocostal surface, and then we will dissect these artery on the inferior surface and then onto the posterior or inferior, close to the inferior surface. So